So I think we'll get started. Welcome, everyone. I'm Kerry Quinn, and I've got the great pleasure of chairing this first in a series of webinars that we want to do for the Scottish older adult research community and for the Scottish dementia and brain health research communities. You'll be pleased to hear I'm not going to speak for very long, but I did want to just take a couple of minutes to introduce the webinar series. So if you'll allow me just to share my screen, bear with me a second while I do this. Now, Jackie, can you just confirm, can you see the presenter view there?
Yes.
Fantastic. So, welcome everyone. As I said, this is the first in a series of webinars that we're going to run every month. And those webinars are going to be themed around issues that are pertinent to older adult research and dementia and brain health research. And for this first webinar, we're bringing together 3 different organisations that all really have a shared aim. So this is a webinar that's being presented to you on behalf of NHS Research Scotland Ageing, and also the Scottish Dementia Research Consortium, and also the Scottish Funding Council Brain Health Arc. And I'm really pleased that we have Dr Yaohua Chen, who's going to speak to us on brain health definitions. But before we get to Dr Chen, I just wanted to do a little bit of an introduction. So I'm going to cover a bit of housekeeping, a bit of a background to this series, a bit of a roundup on what's happening in the research space in Scotland. And then you have what you've actually came for, which is Dr Chen and her talk on brain health definitions. And then we've got lots and lots of time at the end for Q&A. So if we start with a bit of housekeeping, I'm sure all of us are very familiar with webinar etiquette, but just to remind everyone, the meeting is being recorded and the recording will be made available on our various websites. So if you have to leave, don't worry, you're not going to miss anything. It'll all be archived and you can come back at any point in the future and have a look at the webinar. Please do sign up for our future webinars. We're going to have one a month right up until the summer, and I'll tell you what the topics are in due course. These are really your webinar series, and as well as getting really great speakers to talk about their work, it's also a chance just to share things that you want the Scottish community to know about. So if there's anything you want me to raise the visibility of through this webinar, please do just get in touch with me and let me know. As we often do with webinars, please keep cameras off while Dr Chen is speaking. And then at the end, we'll do Q&A, and you can do that using the chat function or raising your hand. So let's move to a bit of a background to this series. Now, if you're a researcher in Scotland and you're interested in clinical older adult research or dementia research or brain health research, hopefully you're aware of one of these 3 different organisations: NHS Scotland Ageing Network, the Scottish Funding Council Brain Health Arc, and the Scottish Dementia Research Consortium. I have the honour and the privilege of chairing all 3. And the URLs are there, and the tags for social media are there as well. Please do join up. Please do follow us. It's free to join all of these organisations. And at the bottom of each of those little captions, you can see what we try and do in the organisations. And across all 3, what we try and do is we build research capacity. We try and help with training, particularly for people who are earlier in their research journey. And we have a bit of an advocacy role for older adults and people living with brain health issues. What we also did across all 3 last year was run a webinar series. And I found myself running 3 different webinar series, which was a bit of a juggling act. So for this year, I'm bringing some of them together, because what struck me last year was a lot of the topics we covered actually spoke to all 3 communities. After the webinar series last year, I asked for feedback. So here is some of the feedback that I got. People wanted more about supporting researchers, more on comorbidities. Some people said they wanted something really different that they'd never heard before. There was a bit of a push to get some international speakers. Some people wanted some stuff on methods, and some people wanted to hear about opportunities. So that is exactly what I've tried to do. And here is your timetable of webinars right up to the summer. So we have our webinar today with Dr Chen, who's going to talk about brain health definitions. And it is shared between Brain Health Arc, SDRC, and NRS Ageing. After that, every webinar is going to be on the first Tuesday of the month. Our next one is going to be about the creative arts, in older adult research, and I'm really pleased that we'll have speakers from Scottish Opera and the Royal Conservatoire of Scotland. In March, we're then going to split things up. So in the lunchtime slot, we'll have a talk that's really more for the NRS ageing community, although everyone is welcome to join. And Matthias Slogel will talk about empathy in older adult research. And then for the brain health and dementia research communities in the evening, although well open to everyone again, we'll have Dr. Hamid Haroun talking about being a neurosciences researcher living with a disability. Tuesday the 1st of April, we'll move back to a shared webinar, and Olivia Wu and her evidence synthesis team will talk about new methods in evidence synthesis. Then in May, we're going to split things up again. So the lunchtime slot will be Dr. Jane Mazzoli talking about cardiovascular ageing. And then in the evening, we'll have Catherine Quinn, no relation, talking about the emotional burden of working in the dementia field. And then we're going to finish on Tuesday the 3rd of June with Tom Welsh, who will talk about the various UK and international special interest groups that support ageing research and brain health research. So hopefully you can see, in putting together the webinar programme for this year, I've tried to speak to all of the different feedback and suggestions that we had from the community. There was one more suggestion that came from anyone that's ever met me, which was have a bit less of me. So for all of the other webinars, I'm looking for people to chair them. So if you want to chair, please get in touch. And I think that's a really good opportunity, maybe again, for people that are earlier in the research journey that maybe haven't had an opportunity to chair a meeting before. This is a friendly, informal way to get your chairing skills under your belt. And how do you find out about the webinars? How do you join up? Well, you can go to the websites of any of the 3 organisations. So you can go to NRS Ageing, you can go to the Brain Health ARC, you can go to SDRC. Although I would encourage you, why not join all 3? And you can get our newsletters and all of our comms. So, as well as invited speakers, what I want to do with these monthly webinars is just give you a bit of a roundup of what's happening in the research space. January is always a bit of a quiet month in research, but there's a couple of things to tell you about. Through the Brain Health ARC, we have a little bit of research support budget. We don't have incredibly deep pockets. We can't give you multi-million-pound grants, but we do have money for seed funding work, for pilot work, for people that need travel support to go to conferences. And we have a larger call that's joint with the Quantum ARC if you have a particular project that speaks to both brain health and quantum. So if you're looking for some funding, please go on the Brain Health ARC website and you'll see the opportunities that are there. As well as these webinars, there are some in-person meetings coming up that I think may be of interest. We have a meeting around brain health research and the arts. It's going to be held in Edinburgh on Tuesday the 4th of April. Details of that, again, on the Brain Health ARC website. Our Scottish Dementia Research Consortium and ARC annual meeting will be in Edinburgh this year in June. Details to follow. And if you like webinars, we have a webinar coming up that's not specific to our ARC, but I think is pertinent to anyone working in research, which is all about research imposter syndrome. And that webinar is going to be on Friday the 24th at 1. So that's my bit over with. You'll be glad to hear. Let's hear about our speaker. So Dr. Yaohua Chen is Associate Professor in University of Lille. She's a neurogeriatrician and researcher. She has a diverse portfolio of work, but a lot of the themes that run through her work are around determinants of brain health, looking at brain health through a diversity lens and multidisciplinary working. She did a residency in neurology, and then she did a translational science PhD that included both fundamental science and clinical research. And now she works in the memory clinic and the acute geriatric service. She's also an Atlantic Fellow for Equity, and I don't know if she's going to talk about that or not, but we can maybe pick that up in the Q&A, because I think that's a scheme that will be interesting to lots of people that are on this call. And she contributes to various national and international brain health consortia, including the EU Geriatric Medicine Society, where I heard her give a fantastic talk on definitions of brain health. And the problem with giving a fantastic talk is you then get asked to give the talk again, and that's exactly what we're going to do today. So we're going to hear that. We're going to hear that talk again today. So that's all from me. I will now hand over to Dr. Chen.
Thank you, Terry. I don't know who put the comment about less Terry Queen, but it's a funny comment.
Probably my wife.
Okay. So I'm gonna share my slides. So thank you for the kind introduction, Terry, and of course, thank you again for inviting me. I really feel honored by this invitation because I start the 2025 webinar series, so it's a little bit pressure as well, but really thank you very much. So as Terry said, I am associate professor in the north of France. For people who don't know where Lille is, you can take Eurostar from London, and then it's the first stop. So it's very, very close. So I changed a little bit the title, but actually the first one was a good idea, brain health definitions with the plural, because actually in the recent literature, there are more and more definitions coming up about brain health. Of course, everyone say, "Oh, my definition is the most representative." But I think the title at first was a good idea as well. And this is from one of the work that I did during my fellowship in the Global Brain Health Institute. So this work has been published in 2021. I updated it a little bit. This is why I choose the title such as "What is Brain Health in 2025?" And hopefully at the end of this talk, you will have a more conceptual but a more practical view of what is brain health, which sometimes could be a concept that seems not very clear. So this is my email address, and as Terry said, you can get in touch with me even after, well, whenever you want, for more questions or collaborations. So I have no conflict of interest to report. Let's start with a short survey. I hope it will work, otherwise it's not important. I see about 30 people attend this webinar right now. So how many among you feel that they can confidently define brain health? And if you say yes, you can put some words to how about what is brain health to you. I can see if you. I hope you can answer directly to the question. Otherwise, it's not. It's a survey that runs by itself, so it should be okay. So why do we need a definition of brain health? Well, you know, the population is aging and the brain health is becoming an important focus for the public health. Of course, with the aging, we have more and more neurodegenerative diseases and also neurovascular diseases. So it's important for people to know how to promote their brain health, how to prevent these diseases, and to better promote the brain health or to develop research, we need a clear definition of brain health. And this is what we see from the current literature. It is increasingly used in professional settings and also in lay settings. And in professional settings, I just put some examples, for example, from the EAN, the European Academy of Neurology, or from the AAN, the American Academy of Neurology. More and more people join this initiative of promoting brain health by giving definitions or working around how to better promote research, how to establish a brain health clinic, for example, to assess people's brain health. And very recently, 2 years ago, actually, the WHO, the World Health Organization, also released a paper about how to optimize brain health across the life course. I think all of this research is very healthy and it's good for promoting brain health. But there are also some other initiatives more from, I would say, no professional settings. For example, some website can sell nutrients or even some programs, and they say, oh, this is for brain health, or this is what you must do. But so sometimes when there are multiple terms and concepts, people can get lost. Well, if you do something, it's always good. But if, for example, some supplements cannot be so good, and sometimes it can be even toxic for brain function. So we think a clear definition is needed. And by the time we did the work, even now, I would say there's no consensus about a clear definition of what brain health is. Here I put a figure about, so when you put brain health in the searching item, you can see there are more and more papers related to brain health. There could be papers trying to define the concept of brain health, or papers that say that the intervention, the outcome of their intervention is to promote brain health. So a lot of papers around it. And most of the papers came from neuroscience, and from neurology, but some of them come from geriatrics and gerontology. There are also some similar and related concepts that need to be, they're related, but they are not really brain health. For example, if we're talking about brain reserve, brain resilience, so they can be components of brain health, but they are not really brain health. There are also the concept of mental health, which is not brain health, but it can be associated to brain health. So what we did is we think by the time I put the pictures of my colleagues who did this work with me from the Global Brain Health Institute, we thought that brain health is a broad concept, and it would be difficult to capture the brain health if we just go with a simple literature review. So this is why we decided to use the methodology of concept analysis. I don't know if you are familiar with this methodology. It's more from the nursing literature. So the idea is to capture the broad landscape of one concept. It could be for brain health, could be for mental health. And we will go through different items such as attributes, antecedents, consequences, and empirical reference. I will go through them later in my talk. And we add also a field work, international survey about what brain health is. Actually, the same question that I asked you in the beginning of this talk. And then we combined both parts to do a hybrid concept analysis of brain health. So in the first part, we did this systematic review in the literature about definition of brain health. And so it was in 2020. So the definition stopped at 2017. There were several attempts to define brain health already, and the last one came from the group with Geriatrics. Actually, they are from the American Heart and American Stroke Association, and different definitions try to give different aspects of brain health. So what we did is we merged them together, and we tried to separate into several themes, and then try to explain a little bit what means each theme. So for example, here, so in total, we decided for 11 themes. And here you can see 5 of them: disease, cognition, well-being, biological, and fitness. So for example, if we choose the theme of disease, that means brain health is the absence of the disease. If we choose the theme such as well-being, that means it's related to the whole concept of health. which means a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So we explain and we detail each theme. For example, the fitness is amendable to and can be the outcome of training interventions. The other 6 themes were dynamic, prevention, optimal, resilience, subjective, and empirical. And again, we detailed each theme. For example, for the dynamic theme, we said that means a lifelong proactive process in which brain health is shaped by the environment and experience. For the empirical theme, we said that means brain health is a measurable function that can be quantified or and graded. So we went through the several existing definitions in the literature, and we classified them into 11 themes. And then we submitted it as in the international survey, as I said, to actually the fellows and faculty from the Global Brain Health Institute. So very, very quickly, what is the Global Brain Health Institute? It is an international institute and an initiative starting from 2015. And the overall aim is to promote brain health, to promote equity in different ethnies and countries. So every year there are up to 15, 20 fellows coming from different parts of the world, and we try to promote the multidisciplinarity. So they are not all neurologists, they are even not scientists for some of them, but they all work in the field of brain health. And we tried with this power of multidisciplinarity to find new ways to original research, for example, local initiative to promote brain health. So that fellowship is for 1 year, but then after the fellowship, it's actually a lifelong process, because you join this international group of senior fellows for equity in brain health. So we submitted this survey to this group, to the faculty as well, and we had about almost 100 answers, of course, coming from different parts of the world, because I said the institute has fellows from different countries. They all work in brain health, but they are not necessarily scientists. Some of them are journalists or musicians. And we asked them how common they use brain health in your country. And by then, in 2020, more than half of the people said no. And for me, for example, in France, in 2019, 2020, I don't remember that we used the word brain health in my country, and this is not something in my memory. Sorry, I did not say where I work. I work in the memory clinic, and this is not something that I talk with my patients, the brain health. And then we asked them if they know what does brain health mean, and we actually got the similar answers from the existing definition. Remember the 11 different themes, and we got the answers such as well-being of the brain, which was one of the 11 themes. Some people said brain health means the absence of the disease. So again, one of the themes that we saw from the existing literature. So they are quite converging with what we saw from the literature. And then we put them together, the findings from the literature and also the results from this international survey. And we went through the different components of the concept analysis. So the first component of a concept analysis is the attributes. What means attributes in the concept analysis? It means what can define the concept and help us to extend the understanding of the concept. So here the question to ask is, what for you are the characteristics of brain health? And we said from the literature and from the survey, there should be 4 attributes, which were lifespan, the continuum, the subjective and the objective feeling, the subjective feeling and the objective measures, and lastly, the multidimensional aspect of brain health. So what is the lifespan attributes? That leaves the possibility for brain health to change over time, and starting from very early, even from in utero, the exposure during the pregnancy to some risk factors or to some protective factors, and so this gave this possibility to brain health to change even in the context of other aging related changes. The continuum is another attribute that we think is important to define brain health, to capture the notion that brain health is not a binary construct. It's not you have a good brain health or you have a bad brain health. It's so that the brain health has the potential to be optimal, but also suboptimal, and it can be optimal even if you have already an underlying pathology such as Alzheimer's disease. And that changed a lot even in my clinical practice. Now when I disclose the diagnosis of Alzheimer's disease to my patients, I will switch my speech very, very quickly to brain health and to explain that actually even within the diagnosis of Alzheimer's disease, we can find personalized solution to optimize their brain health. The third attribute is the subjective and the objective measures, where it can be understandable very easily. The subjective feeling is the brain health should be experienced by each person, and it should be subjective. First, a subjective well-being of this person, and we will talk a little bit about how to measure them objectively. And lastly, brain health is multidimensional. It's not only the cognition, it's not only the emotion, but it should encompass the motor function, the behavior in the society. We will describe a little bit later, but it should not be just about neurology or just about the cognitive functions. After the well, it's not really after, because it occurs before the concept, the antecedents. So what are the conditions necessary, or not the absence of the conditions necessary for brain health to occur? So here, actually, there can be many antecedents. It can be several papers here, so it's impossible to go through all the antecedents. We just classify them into internal antecedents and external antecedents. And of course, research is ongoing. We can discover more and more new external and internal antecedents. But for example, if we're taking example of dementia, we know that up to 45% of dementia can be prevented due to different risk factors, for example, and these risk factors can be included in the antecedents of brain health. And now the consequences. So what are the consequences of this concept if it occurs? And as I said, we don't see it as some binary concept. It's a continuum from optimal to suboptimal. And we said that there are 4 consequences for brain health, which were adaptability, resilience, social connectedness, and independence. So adaptability is the ability of a person to cope or to function even with neurodegenerative disease or due to other illness. The resilience is the capacity for people to bounce back after adversity. Social connectedness is critical for people to find a meaning, for example, in their life. And independence refers to autonomy and independence that link to different capacities. So that's the 4 consequences for brain health. And lastly, so one concept should be measured. So that is the last part of the concept analysis, which is here the empirical reference of brain health. How we can measure brain health? We ask this question to the international fellows, and there were a lot of ideas, a lot of answers, such as neurocognitive testing, depression assessment, cognitive reserve score. There are clinical measures, but some other people suggested functional biomarkers or brain imaging. And very recently, there was scoping review about different all the papers that cited brain measures, and if we excluded papers that used the measure only once, the other papers they mostly measured the MRI, so the imaging. So they only use one domain to measure brain health, in yellow here. There are only one paper that measured 4 domains. There's only one, so you can even not see the blue area here. And in this paper, they measured cognitive function, imaging, of course, as well, imaging, biological, and the mental health. So it's not very easy to measure in brain health, and in the literature we can see it. I think we can separate single measure from composite measure. So as a single measure, that is where we found mostly imagings. For example, maybe you are aware of this brain health index or brain age gap. So both are actually the measures from MRI. The brain health index is a combined MRI score to quantify neurovascular and neurodegenerative injuries. It's a very complex calculation I cannot explain here, but then at the end, the people will have an index. Or the brain age gap is the difference between the chronological age and the brain age, again estimated in MRI. So these measures, they have the advantage to be easily reproducible, and it's very easy to use, of course. But it's complicated to say that one single measure can reflect brain health. As I said just before, brain health has several attributes, lifespan, continuum, and it's difficult to imagine that one single measure can reflect all the 4 attributes. And also, if we use MRI, there's a really concern about the accessibility and the equity of this technique everywhere in the world. So that means we exclude a lot of people from the possibility to measure their brain health. So the other alternative is to use a composite measure. So there are a lot of composite measures. So here I just cited the BBHI from Barcelona Brain Health Institute. So they actually define 7 pillars of brain health, which can reflect very well the multidimensional attribute of brain health. This is the example of one person. So they will give a kind of score in each pillar, which were cognitive, physical exercise, nutrition, vital plan, comprehensive health, socialization, and sleep. And at the end, they will give this this score to the person who gets this assessment. It's easy to access because it's mostly clinical. It's a lot of questionnaires, but again, this kind of composite clinical measures, they need validation. But it's put the emphasis on the brain health is a subjective experience related to how you perceive your performance and the cognitive function. So I think in the future, the brain health should be more measured like this kind of composite scores that reflects better the different attributes of brain health. So now we will integrate all the different components in the final concept map. It's not a very beautiful map because I designed it and I'm not very creative. But you can see that different components of these concepts are displayed here. So from antecedents, the attributes that can define brain health, and the consequences from the optimal to suboptimal functioning. And at the right of this concept map, we can find the two different kind of measures for brain health. It's just the summary of what I just said, so I will just go to the next slide, which is, I think, the most important one. So here is the proposed definition from our group for brain health. And again, of course, I like it a lot because it's our definition, but there are different definitions in the literature I can show you later. Our definition, I think, is a little bit long, so maybe it's not very easy to use, but hopefully it really takes into account the broad concept of brain health. So let me take 1 minute to go through our definition. Brain health is a multidimensional, a dynamic state occurring along the life course, incorporating cognitive, emotional, and motor domains underpinned by physiological processes. This can be objectively measured and, above all, subjectively experienced. And brain health can be influenced by biopsychosocial determinants, resulting in a continuum of quality of life and wellness. It is long, but I think it really captures different aspects of brain health. So what's next after 2021? I told you that a lot of initiatives started in different disciplines and also around the world. Here I summarized the different definitions after 2020. Some of them we can, if we summarize all these definitions, we can really see a shift from the idea that brain health is the absence of a brain disease or is the absence of cognitive impairment, of dementia, because these are the first definitions in 2020 and 2021. The authors still put the emphasis on the absence of the disease, but then more and more definitions take into account that brain health can still occur even in the presence of a neurodegenerative disease, for example. That is the other different definition in 2021 or in 2023. So from the World Federation of Neurology or from the American Academy of Neurology, and they are common in some points, saying that it should be multidimensional. It is continuous states of maintaining the optimal function. Of course, the Neurology Academy said it's optimal neurological function. And I know there's also another initiative that is ongoing because I did not see the result from the literature. The group proposed an integral brain health view that includes cerebral, mental, and the social health. And let me just take a few minutes about this initiative from the World Health Organization. So the paper was released in 2022. You can find it very easily in the internet. And they gave another definition, which I think echoes very well with ours. So for the WHO position paper, brain health is the state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course and very importantly, irrespective of the presence or absence of disorders. Again, this concept that it is a continuum and people can achieve brain health even with brain disorders. It is continuous interaction between different determinants and one person's individual context lead to a lifelong adaptation and functioning. And optimizing brain health improves mental and physical health and also creative positive social and economic impacts. So their definition is also quite long, actually. So that in this paper, in this position paper, they go through how to optimize brain health at an individual level. Remember, we listed some antecedents, but of course they are not comprehensive. And here they listed different components according if they are from physical health, environment, if they are related to the safety, to learning, and to quality services. So again, a really long list of different determinants or antecedents that one or the society needs to address to optimize brain health. So I will just I will not go through each of them, of course. And they also emphasize on the importance to optimize brain health at a global level. It's not only an important outcome on itself, but it's also an important mediator for other health, such as mental health, social health, and also other societal outcomes. So optimizing brain health is important to ensure even the global well-being, the global health. So here are my take-home messages. I hope I convince you that brain health is a dynamic state, irrespective of the presence of the absence of disorders. It comes from continuous interaction with different determinants across the life course that need really coordinated and interdisciplinary. We talk about neurology, geriatrics, psychiatry, and even from other disciplines, not just medical disciplines. We need these collaborative strategies at an individual level, but also at a global level to optimize brain health. There is a recent review about how people are aware about brain health. People had a lot of negative ideas about brain health. So in the future research agenda, I think we should also include a lot of participatory research and also evaluation of the health systems. So allow me to put our definition again. It's a long, but I think it captured this concept of brain health. So what we can wish for the new year. I don't know what you wish in Scotland. In France, we usually wish for health and happiness. So maybe we can wish to everyone optimal brain health for the new year, 2025. So thank you very much. This is the end of my topic.
Thank you so much. I mean, it's so interesting to hear all the work you've done. I don't think you should apologise for having a long definition, because it's a complex, multi-dimensional construct, and you run the risk of not capturing that if you try and create something that's too pithy. So I think your definition is spot on. So let's open things up to questions. Just to make it easier for me, if you could put your questions in the chat function rather than the Q&A function, and I'll keep an eye on that. While people are thinking and typing, I wonder if I could ask a couple of questions. And the first one is about how does a definition become visible and gain traction in the community? So I've seen initiatives before where people have tried to define things and they do lots of work and they have a really nice definition, but it just isn't embraced by the community. So how are you going to take your definition or the WHO definition and make that the definition that is standardized?
Yeah, I think it's a really important join the global initiative. One's definition cannot just stay in the community of geriatricians or of neurologists or even in the community of European neurologist and not goes otherwise. And I think now there are a lot of initiatives, and each of them, what I read from the AAN, they said neurologists should take this over, and we should include neurology in the definition. But I think we need to go beyond this disciplines, because it's actually really interdisciplinary, and if not just only medical, we need to include sociologists, we need to include all the people in the definition, and then touch the lay audience, because it's not only something about the research. We need to spread this word to different communities, and that is why I said there's a very interesting review about how people perceived brain health, and it's actually a lot of negative ideas, just at the stigma people have about the dementia. And so from my level, just my personal level, now every time I disclose the diagnosis in the memory clinic, if it's mild cognitive impairment, Alzheimer's disease, I always try to include the concept of brain health, and it's actually give another perspective in the discussion with the patient and the family, because after diagnosis we will go very quickly, we move to a very positive thinking about their disease, and make them proactive, actually empower them in this approach. And I think it helps me a lot in my clinical practice, and this is we need to try to make this definition more visible for everyone.
Couldn't agree more. And it's music to my ears to hear you saying about this needs to be multidisciplinary. It can't be owned by neurology or psychiatry. It's bigger than that. So we've got lots of questions coming in. I'm going to try and get through them all, but to be respectful to people's time, we will finish on the hour at 2. So we've got a question from Lucy Sterling, first of all saying how great your talk was, which of course it was, but she's asking, in the 5 years since you started writing your definition, have you noticed a change in how the community are using the term brain health?
I think the community is using more and more the term, but still we don't have a consensus definition of brain health. What I showed is in the first years, they are still related to the absence of the disease, but actually recently they shift a little bit to a definition that can occur even with the presence of the disease, and they include more and more the multidimensional states of brain health. So this is the shift that I can see from the existing definitions. And there is also more and more initiative that say, okay, we need to go to the interdisciplinary approach. We can just not stay in our own field. So that is the change that I can see. And our definition is sometimes cited, sometimes not, but it's...
So lots of questions coming in. I'm going to summarize some of them because some of them are quite lengthy. So what one of our attendees has noticed that they're now diagnosing more mild cognitive impairment than frank dementia, and wonders if an awareness of brain health is changing referral practices into services. Is that something that you've noticed?
So in France, there's, I think, a lot of local issues. Maybe I hope we can get more referrals because of this. But I think the if that is the question, but how to get more, how to get people aware about the early diagnosis of mild cognitive impairment or dementia, I think that comes from a joint effort with the family doctors, with the also the recent therapies, but in France it's a little bit difficult because they stopped reimbursing the usual medication, so that stopped a lot in the referral of patients, because people will say, oh, there's nothing to do. Even the government decided to stop the reimbursement of the medication. That means there's nothing to do with the dementia. And so if we can incorporate the concept of brain health, I hope that will give also the arguments for people that there's always something to do to promote brain health.
Yeah, absolutely. So I've got two questions that I'll roll into one, and they're asking, in what ways does the brain health definition differ from other definitions that will be pertinent to older adults, like frailty or health in general?
Yeah, so I think it's a good question, because some of the definition about brain health, they get inspired from the definition of health. That saying it's the absence of the disease. So some of the definitions really compare to existing definition of health or frailty. But again, I think these terms are all very good for a concept analysis, because they are all very broad. So I think they are good candidate for a concept analysis. And in the definition of brain health, we did not put actually the concept of frailty, because otherwise I think we will need to expand more the definition. But I think it still can be pictured as something that you can develop with the presence of frailty, the brain health.
Yeah, I mean, it's a Venn diagram that has lots and lots of overlap.
I think it can be a lot of overlap. But I think that what we try to give to the definition, our definition of brain health, is to say that there is really something positive to do with the brain health. It's something that you need to keep optimizing along the life course. I think we try to give this.
Thank you. We are short of time, and there's one last thing that I do want to just ask you about, because I think a lot of the people on the call will be interested to hear more, and it's about the Atlantic Fellows Initiative and Global Brain Health Initiative. If people on the call wanted to find out more about that or become involved, how would they do that? And is that something that you would recommend?
Yeah, sorry, I did not put. Usually I finish this talk with the QR code about the brain health, but I just checked. They did not start recruiting yet this year, but yeah, every year. So you can check on the website of Global Brain Health Institute. They launch every year a recruitment. If you are interested in promoting brain health, if you are interested in learning more about brain health, and I think if you are interested in promoting equity as well, and the opportunity actually to work with people, very, very interesting people, but from different disciplines, as I said, across the world, I think it's definitely something that will be interesting to you. And if you are a doctor, if you are a social worker, if you are a musician, I mean, the background does not count. It's really the interest that you have to promote people's brain health. And it was a fantastic year for me, even if that stopped with the COVID, but then we turned to virtual as everyone. But the first 6 in-person months were really fantastic, and it does not stop after 1 year's fellowship, because you join this bigger community, and there were some fundings as well, but also a lot of training, a lot of collaboration opportunity actually. So yeah, I can just say that I encourage people to apply for this program, because it's really a unique program.
Thank you. I think that's a good way to end things. So thank you very much for such a fantastic talk, and it really was a great way to set off our webinar series. You ended your
Thank
talk
you.
on New Year. Here we often have New Year's resolutions, so maybe we can make it a resolution for people to join again, first Tuesday of every month at lunchtime for webinars. But with that, I will say goodbye to everyone. Thanks for listening, and Dr. Chen, thanks for your fantastic talk. Okay, bye everyone.